My name is Amanda Thakathaka. I'm a medical doctor from Zimbabwe. I completed a postgraduate diploma in Preventative Cardiovascular Medicine in September 2020. Currently, I'm pursuing a master's in the same program, and I'm set to complete it this year. I have always been a public health enthusiast, and when I enrolled into this course, I knew it would help my understanding of cardiovascular medicine and would make a difference in the area of non-communicable diseases in Zimbabwe. This is an area that has largely been in the background of healthcare in Zimbabwe, like in most other African countries, who are at the moment at a high risk of dual burden of disease with long-standing communicable diseases and emerging increase in the non-communicable diseases. Cardiovascular risk factors like obesity, smoking, hypertension are on the rise in Zimbabwe, and cardiovascular-related diseases like diabetes, coronary heart diseases, and their sequelae, stroke and cardiovascular-related mortality have become even more prevalent than before. Studies in Zimbabwe have shown that at least 1 in every 3 adults above 30 years old are borderline hypertensive or overtly so. This means that cardiovascular disease is becoming a public health threat in our local context. My completion of the postgraduate diploma and this master's in Preventative Cardiovascular Medicine that I'm also pursuing came at a time when I can be part of the public health specialists who make a difference in improving cardiovascular care in Zimbabwe, access to medicines, and diagnosis and treatment of cardiovascular-related conditions. As part of my requirements in this course, I am conducting an assessment of clinical guidelines for the diagnosis and treatment of hypertension. The main interest in this assessment is to look into guideline development and analyze the existing local guidelines for their strength, their weaknesses, and differences in the context of international and evidence-based standards. I plan to continue being an active advocate in the prevention of cardiovascular disease in Zimbabwe by setting up wellness clinics that advocate for the primary prevention of cardiovascular diseases through healthy lifestyles, exercise, smoking cessation programs, adopting healthy dietary options, and routine assessments to ensure early diagnosis and interventions. I have been encouraging colleagues to take up these postgraduate courses and apply for the scholarships that are being offered by the Merck Foundation through the Ministry of Health recommendations and the ambassadorship of Her Excellency, the First Lady, Mrs. AUXILLIA MNANGAGWA. Not only for the obvious benefits of having an added qualification to my portfolio, but to improvements in the quality of healthcare that one gets to offer through broadened knowledge in the subject area they would have chosen. This I have witnessed myself. Through the scholarship, I have had an opportunity to study with an internationally accredited university in a field I am passionate about. This is something I would not have been able to do with my own efforts alone, but with the Merck Foundation Scholarship, I am proud and thankful that I emerged with a postgraduate diploma and an opportunity to pursue a master's degree. I have had the opportunity to interact with students from all over the world and have gained knowledge on cardiovascular diseases and prevention in the world. I appreciate the opportunity I have gotten from Merck Foundation and hope that more medical practitioners continue to benefit from this program.